We know that it was developed in the 1970s by NASA, and they used it initially for bone density issues with astronauts who've been in low gravity for a while, and subsequently discovered that the PEMF stimulated bone growth and increased the amount of osteoblasts, which is the bone tissues, and so it also helped broken bones to knit, bones that weren't healing. So people who should have had their plaster off their broken leg still had a plaster on it, not after 6 weeks, but after 3 months. And amazingly, when PEMF came along, suddenly the bones started to knit. So that was an exciting discovery. And of course, the body is a very electrical device, which a lot of people don't realize how important electricity is. It's what our brain makes when it wants us to move a muscle. It sends a signal down our nerves, and that stimulates the muscles. So we are entirely electrical, and there's an electrical component in every cell. So we typically start out with a 10-minute session where people are sitting with a mat against their back, which is giving them little pulses of magnetic energy, and it makes your muscles twitch involuntarily. So it's very it's an exciting experience. So one of the things that we've discovered is that the pulse magnetic therapy will pick up areas of inflammation. So and which is exciting. So I can't really call it a diagnostic tool, but it does. You can discover that you've got mild inflammation in a joint that you weren't really aware of, maybe hips or something. And PEMF is, and then what PEMF does is it encourages the capillaries to open up around the inflammation, which brings fresh blood there. So a lot of times people get stiff muscles, and when you've got a stiff muscle, you've got no blood flow. When you've got low blood flow, you've got low oxygen, and it's painful.